Good day everybody, this is Frontline from Key Wealth, and this is a quick video on the Discovery Health Medical Scheme Smart Plans for 2025. I'm going to skip some of the first few pages. It's got some nice key terms where they discuss certain meanings of certain words and benefits that you've got. You can maybe just read through it if there's something that's important to you. We'll dive into the Personal Health Fund a little bit later, which is an exciting new benefit that Discovery is launching, and it gives you some additional day-to-day, so that's great. And here's the first page that I want to stop at today is the benefits that you've got with this plan or with these plans. So if we look at the entry-level one, the Active Smart, which is a new plan that Discovery launched, you have access to hospital cover in the dynamic network, so it's a smaller hospital network. Then you have unlimited GP consultations with 125 Rand co-payment, which is very nice. You've got a test with an optometrist at 125 Rand, and then 190 Rand for a dental checkup. So those are all very nice. And then there is 535 Rand over-the-counter medicine at a network pharmacy. So that's really, really nice on this Discovery Active Smart plan. There's no cover for acute medicine, in other words, prescription medicine. And then there's also no cover for sport-related injuries like on the Classic Smart. With the Essential Dynamic Smart, it's very similar. It's also the dynamic network, the dynamic smart network. It's got the same benefits. You just have a slightly higher over-the-counter benefit of 585 Rand. And then the same so also for Essential Smart, the same benefits that you've got. It's just a larger network of hospitals, which is very, very nice. The Classic Smart, a great value for money, 70 Rand co-payment if you go to a GP, a network GP, so that's very nice. 70 Rand for your optometry or eye test at an optometrist, 125 Rand co-payment for your dental checkup, so that's very, very cool. You've got a nice 875 Rand benefit for the year per family for over-the-counter medicine. So that's your Schedule 1, Schedule 0, 1 and 2. And then you also have 3,180 Rand per family, or 1,905 Rand for prescriptions for an individual, and that would be for Schedule 3 and upwards. So that's very nice. Then you also have your sport-related injuries, which is 2 specialist visits or 4 visits to a physio. It's like something if you sprain an ankle or pull a hammy or something like that. The maternity cover on these options are also very nice. You've got your chronic dialysis at the Essential Dynamic Smart and Active Smart is a state facility, so just take note of that, where it is with a network provider on the Classic Smart. Your cancer cover is 250,000 Rand on your Classic Smart, Essential Smart and Essential Dynamic Smart, and with the Active Smart it is a PMB limit and also limited to network providers. Your hospital cover on all of them are unlimited. Just take note that there is a 70,000 Rand limit for neonatal admissions on the Active Smart, and then there's also 7,500 Rand co-payment for elective procedures. So it's important to know here that they're looking for young individuals to go onto this option, and it's not someone that's planning to start a family. It's not someone that's planning to go to a hospital for every single thing every other month. I've mentioned the hospitals previously, so I'm not going to go into that again. On the Essential Smart, Essential Dynamic Smart and Active Smart, you've got 100% in hospital cover, where with a Classic Smart, like all the Classic plans with Discovery, you've got 200%. Your Classic Smart has great cover for MRI and CT scans. If it's not part of a hospital admission or it's for conservative back and neck treatment, then it's the 3,850 Rand co-payment, which you can claim back from your gap cover. So it's always important to add that. And then with the Essential Smart, Dynamic Smart and Active Smart, it's important that it has to be part of your admission, or it should not be part of conservative back or neck treatment, meaning it should be for an operation. Then Discovery would pay for it. You've got full access to PMBs on these options. I'm not going to go into the detail of that. If you've got any question, you can reach out to us, but PMBs are basically something that all the medical schemes have to cover. It's a list of 271 defined conditions, 27 chronic, so that's like blood pressure, cholesterol, asthma and things like that, and it's covered on these options like everything else. So I want to stop here by the personal health pathways. It's a very nice benefit that Discovery is going to launch for 2025. What you do is you download the app, you review and start the process, and then you complete what Discovery tells you to. So they'll say, and you'll see on the next page, they'll tell you to go to a doctor or to take your blood pressure or something like that, and then they will award you a set amount that you can get because you are trying to be healthier. So that's very, very cool. You can pause the video here just to see some of the stuff. It's like getting a flu vaccine or collecting your chronic medicine or going for a pap smear or something like that. So you can pause here and read to see what they'll expect of you to do. And then here are the limits or what they will give to you. So on the classic plan, you can get 2,000 Rand per adult and 1,000 Rand per child to a maximum of 8,000 Rand for the family. And then on the essential plans, it's 1,000 Rand per adult and 500 Rand per child, up to 4,000 Rand for the family. So just as an example, if you're on the classic smart plan and it's 2 adults and 2 children, you can get 6,000 Rand additional benefits for day-to-day or whatever it is that you needed for that. Discovery will pay just because you try to be healthier. So that's very cool. Very cool to take note of here is also this part. If you join Discovery for the first time in 2025, Discovery would give you this amount depending on the plan and the family size upfront for the year, and you'll also get access to that. So if you join this option for the first time, you'll get your 6,000 Rand in the scenario I used above, and you can get your 6,000 Rand throughout the year by engaging with your personal health pathways. So that's very nice. I'm just skipping some of the stuff that isn't most commonly used. Discovery does pay for the screening, so you can do your blood pressure, blood sugar, and BMI and blood glucose and things like that with Discovery. They also pay for mammograms every second year, and pap smears every third year. So you can have a look at that if there's something that you need, or just be aware that you can go for these things. There are additional tests in certain scenarios that they also pay for. The day-to-day cover I've also already gone through, so you can pause your slide or the video here if you want to look at it in a little bit more detail, but very, very nice benefits that they offer on this. So the maternity benefits, very, very cool. Just take note that it is a little bit different on the Active Smart. It's subject to available day-to-day benefits. On all the other plans, you have your 2 visits for a GP or a pediatrician or a ear, nose and throat specialist. If a baby is born after you give birth, you've got your 8 antenatal consultations at a GP or a midwife. You have your flu vaccine during your pregnancy, so that's covered. You've got your ultrasounds that they pay for, so that's also very, very nice. Certain blood tests that you can go for. And then postnatal, you've got 5 antenatal or postnatal classes with a nurse, so that's very nice, like to assist with breastfeeding or something like that. And then you can just register for this on the maternity benefit. So very, very, very nice. Something to take note of here is that Discovery does not pay for the immunizations of the babies when they are born. So it's a very good maternity benefit, but just take note that that specifically is not covered. You do have your chronic benefits. I've mentioned that earlier. You can pause it here to just have a look at what all qualifies as chronic benefits. I'm just going to mention some of the most common is asthma, bipolars in here. You've got your blood pressure, diabetes, epilepsy, glaucoma, rheumatoid arthritis, ulcerative colitis, and any of the others also. Just know that you have to use a formulary, and if your medicine is on the formulary and your chronic condition is registered, then you can go and collect your medicine. And then on these options, it's also part of a network pharmacy. Otherwise, there might be a 20% co-payment. Discovery's got many care programs. So You can have a look at this. There are mental health care programs, disease preventative programs where they identify you for cardiometabolic syndrome, diabetes programs. If you fall into one of these categories, you can reach out to us and we can help you to engage with them. There's also a very good cancer cover with Discovery, where it's a 12-month cycle. So just know that if you get diagnosed in July, it will carry over to the next year, the following year from June. You've got 250,000 Rand on all the plans except for the smart, active smart plan. Once that's reached, you've got unlimited cover, but they cover 80% of the rate, so meaning you've got a 20% co-payment. And then they also work with specific providers. So if you don't want any co-payments, then you have to use Discovery's preferred partners, but that should not be an issue. With a hospital cover, here's a nice summary. They pay their rate. If you go to the wrong hospital, then there's a 12,200 Rand co-payment on the Classic and Essential Smart plan. On the Essential Dynamic Smart and Active Smart, it's an almost 15,000 Rand, 14,750 Rand co-payment. And then also just take note of that neonatal limit in hospital. On certain on payments for upfront payments for elective non-emergency admissions, there's 7,500 Rand on Active Smart, and there are no upfront co-payments on the other smart plans. There are specific defined lists of payments in a day surgery network where you can be asked to make some of these co-payments. So just take note of those limits. And then furthermore, like I've mentioned earlier, there's 200% on the classic plans, 100% on the rest of them. Blood tests and x-rays are covered to 100%. And then I've also explained the MRI and CT benefits, so just take note of that. Then also a new thing with Discovery is that there's a cataract surgery network provider from next year. So if you have cataracts, just know that there's now a new network that you have to use. And then there are co-payments on certain scopes or on scopes. So 4,500 Rand if you go for one scope, 5,500 if you go for gastroscopy and a colonoscopy. It's a little bit reduced. So that's in a day clinic. If you do it in a hospital, it's a little bit more expensive, 7,700 and 9,600. And then if it's part of the value-based network, the co-payment is reduced to 6,400 or 7,950 Rand respectively. If it's in a doctor's room but it's not part of their network, then these co-payments would apply. The important thing to take out from this is that there are co-payments on scopes, and that it is important that you add a gap cover to your medical aid, because these things can all be claimed back from your gap cover. There aren't any co-payments on scopes if it's part of a PMB, if the patient is under 12, or any of the other conditions that's mentioned in this little block at the bottom. Take note that all of these aren't covered. So this is a nice slide with some of the benefits that's available in hospital, but it's not on the Essential Smart, Essential Dynamic and Active Smart. So there's a different list of exclusions, but on the Classic Smart, things like cochlear implants are covered up to these limits, and then also your joint replacements. Joint replacements are excluded on the Essential Smart, Essential Dynamic Smart and Active Smart plans. The alcohol and drug rehabilitation will be covered by all, the mental health by all. So just take note that if you have any joint procedures or joint replacements or any major prosthetic devices or internal nerve stimulators or cochlear implants, that you should rather be on the Classic Smart or any of the other Discovery options that cover them. There is cover for in-hospital dentistry, and if you are 13 years and older, it's 8,650 Rand co-payment. At day clinic, 5,550, and then if you are under 13, it's 3,350 or 1,500. So just take note of those co-payments. Again, you can claim these back from a gap cover, so always important to have a gap cover. These are the co-payments that I've mentioned earlier for certain procedures in a day network, so just take note of that. And then these are the procedures. So if there are any of these procedures, you can pause it, and have a look at it. If there's something that you've got to do, just note that there might be a co-payment. There's no co-payment if it's in your network day surgery, but if it's out of network, then you do have those co-payments. Again, you can claim this back from certain gap covers, so always important to have. Right, there are many benefits with Discovery. They've got an Africa evacuation benefit, something that's nice to take note of. They have a spinal care program. It's a conservative treatment for your back before you before you go for an operation. They've got a new supportive post-surgery program, which is for certain procedures where you're not in hospital for very long, where you'll have a certain basket of care after your operation. So that's very, very nice. They do cover certain things in doctors' rooms so that you can avoid co-payments or have smaller co-payments. They also have an international travel benefit, so that's also very, very nice. And here are the contributions for 2025. On Classic Smart, for a main member, it would be 2,822 Rand, and an adult 2,227 Rand. And I think a wonderful contribution to their option range is the Active Smart, which you can get for 1,350 Rand. So very, very nice benefit on those options at an affordable price. You can pause here for the rest of the pricing so that you can just see how it works. And that's it, ladies and gentlemen. Thank you for your time and for viewing this video. And if you've got any further questions, please reach out to us. Thank you.